Thank you, moderator, and thank you, Dr. Zhang, because Dr. Zhang is the first one to bring me to TSIR, and thanks to Dr. BB too. Okay, thanks to GE Healthcare, I run my own clinic now in Taipei with all the GE machines. So I won't use too many pictures from GE because I know everyone wants to see the real world pictures. So, but some data I will also use their data. Okay, so I'm now running the clinical mainly practice pain management. But as you know, we are now trying to do some men's health treatment too. If there's time, I will show some videos from the GE Healthcare. Okay, so this is a logo from my clinic. Thank you. I hope this share is very easygoing, so anyone can raise your hand if you want to ask me questions. I am from Chang'an University Hospital in Linkou, and after I training, I go to Shanghai and a local hospital called Lancy. And after my training with some chance, I came to Taipei, then have my own clinic. Okay, so this is today's topic. This is OEC and 3D C-arm. And why are we using 3D C-arm for pain management? As you can see, this arm of C-arm is not typically C, it's mostly O, because with this O arm, you can do a 3D scan to have a combined CT with good quality. And the monitor is very big with a remote control. So the only thing we cannot control is the bed. So you have to buy a radiolucent bed to do a room like Angel Suite. But if you have the radiolucent bed, almost you can do anything in Angel room in a Sion room. So in the pain management, the guidance is very important. In our older practice, we use ultrasound or fluoroscopy separately for most of the time because the rehabilitation doctors, they use ultrasound very familiarly. And as we radiologists, we use CT guidance, or like surgeons, they use fluoroscopy guidance, all have their advantages. But nowadays, like Dr. Xu Yizhi Zuren, now using fusion images. Why we use dual image or even triple image? Because we need to do safety and precise needle position at the same time. And now this is a big issue, so I won't put many words on this, but rapid diagnosis is very crucial for pain management. If we don't have the right diagnosis, the treatment won't be useful. So a rapid CT or even a green tunnel to a hospital's MRI is very crucial. So this is my clinic. I run a Japanese style clinic. So when the patient can, after the visit, we do a high quality ultrasound for their knee or for their shoulder to see is there any structural destruction or any abnormal vessels, because we radiologists are doing a lot of time for the chronic pain. And after the diagnosis, if the pain cannot be treated by ultrasound injection, or we can put it in a like OP room. So this room is built as a standard in the hospital. We have HIPAA, we have all the radio proven wall, and with this C-arm. So you can see this part of the bed with carbon. So the X-ray can see through all this portion. And we have bought another additional monitor. If the position cannot be very good for the operator to see the monitor, we can connect the cable to this accessory monitor. Because in Taipei, the land is very crowded, so the LP room is very small. If you came to my visit, you will be very overwhelmed how small it is. But it also can do a lot of things. Okay, so SIR, our most important thinking is how can we evaluate the vascular structure. So nowadays, the vascular software in C-arm is quite good, even though you cannot use the fluoro too long because the heat will let the machine shut down. But if in 1 hour, I think I never happened to occur any machine shutdown issues. So this is the previous planning of our clinic. So when patient came in, he can go to the office and have some history taking. Then he can receive immediately high quality. This is the GE E10S, really good for the MSK. But some vascular software is not so good, but we evaluate MSK mostly. So it's very good, and you can see all the spine structure very good. And if the patient has outpatient CT or MRI, we can immediately do the fusion image for injection. So the fusion is a very good example for dual image because the patient can do the high quality CT or MR in other place, then bring the high resolution image CD to our clinic. Then we can use the CT or MRI to see is the structure still damaged under the ultrasound, and we can put our needles very precisely. And if the patient cannot be treated by ultrasound only, we are planning to do the treatment further in the OP room. And you can see there's another office with another mobile ultrasound because I insisted to do dual image in my OP room because sometimes you cannot see the vascular structure under fluoroscopy, and it's too time consuming to do combing CT every time. So in every patient, I use ultrasound combined with fluoroscopy for the pain treatment. And we also have the observation room. Because this room is set as an OP room, and we do femoral punctures, we do radial punctures, even some doctors, some surgeons want to do the varicocele, or even they want to do the arthroscope, but I am so scared I cannot let them do. But we have observation room, so femoral puncture is totally okay in our clinic. And one of two cases, we use dark clothes, and he can get off the bed like in 1 hour and go to the restroom, go to the sofa area and have some pressure time. Okay, so I will share two cases with to show how it's important to have a quick diagnosis and a precise treatment. So this is the case visited my clinic just last week. He never feel any low back pain before, but about 1 week ago, he sit a long train, a very long time, and he feel a sudden of sharp low back pain, and he went to a local clinic for caudal injection. Caudal injection is also a good way to perform safe epidural steroid injection. It responds once, but the pain recurrent only in 2 days. So because the doctor in the clinic is my friend, he asked me if I can do transforaminal or even catheterization into the epidural space. So he came to my clinic with his MRI, but you can see later the foramen is quite good and without any stenosis. And even the MRI show mild HIVD, but the pain score is very high, near 7 to 8, and it cannot be treated by any medication. So I'm very curious what happened to him, and I do some X-ray examination. So this is quite typical case for a unique disease, and we are all radiologists. We have good eyes, so you can see he has an accessory joint here. This is a Bertoni syndrome. So the patient, even though his vertebra is still good and only mild HIVD at the L5 S1 area, but however, because of this structure, his foramen is smaller than normal people. So maybe this is why he's so painful, even the HIVD is so small. So after I saw this KUB, I immediately arranged a combing CT for him to show him that this is why he is so painful. So with combing CT, we can see all of these accessory joints very clearly, and the foramen is more smaller when we go out to the extraforaminal zone. So his compression area is maybe not in the foraminal zone. It's maybe outside of the foraminal zone. So the traditional transforaminal injection may not be suited for him. So you can see this is a 3D reconstruction. Very beautiful. You can see the foramen and see the accessory joint. So this kind of syndrome is not very easy to treat in a paper or in a review. Mostly the patient can be treated by conservative treatment or even by medication and some physical treatment. But this patient, his pain score is very, very high, and the normal is epidural steroid injection can only less than 2 days. So I persuade him to do the castration, epidural steroid injection. We put a sheath in the caudal canal, then use our J curve to cannulate the left side foramen. So you can see the epidural space is really, really tiny at this area. But it is no other stenosis at other level. So after the cannulation, I try to injection this joint for steroid because in a review and in our experiment, this joint will be often inflamed because the unbalance of his structure. So when the patient is young, it's okay to have these joints because his body weight is not too high and his muscle is good. But when we're getting older, we are getting fatter to overweighted. And even though with some degenerative change, this structure will trigger a lot of pain. So this is how we can see the constant median spray into the epidural space and leave the foramen in around the nerve root. So this is the constant median spray. Okay, so the other case. So this case is my father because he was a hard worker, taking a lot of carriage all the days. So his lumbar spine is really bad, and he have some surgeries like 5 or 10 years ago. But after the surgery, the sciatica is getting better, but the low back pain and the intermittent numbness still troubles him a lot. So I decided to perform as an example for how OEC3D can do a diagnosis and treatment at first. And this video is announced in May, so some of you may have seen that. Okay, so let's play this video. Oh, it failed. Okay. So it's very pity because I tried in the preparation room. It's okay. So maybe okay, so we can see some images. So after the combine CT, we can see the foramen is really tight, even though he has some fusion. So this may be the new spur formation and compressing the foramen. So because his pain pattern is quite different every time, so I cannot locate it very well based on the symptoms. So thanks to OEC3D combine CT, I can find a new foramen stenosis without going to hospital using the MRI. So you can see the 3D remodeling is also very clear. So under the fluoroscopy, since we know the target, we're using the transforaminal injection, but however it is very tight. The foraminal space is very small. So it took me some time to put a needle into the foramen. Okay, so, luckily in the end, we just passed through the spurs and put my needle into the foramen. So, and as you may concerned, is the dose of the 3D scan very high, but as we can see in this picture, the milligray of the OEC3D is around 1, and they didn't show the microsievert of the dose in the machine, so I cannot give you the exact number, but accumulate the dose is not very high, and then comparing to other brand is like 4.2, and this OEC3D is 0.8, so it's much lower than other brands, and the quality is very good. When I see this 3D remodeling in Beijing, I feel it can suit my quality. Okay, and as my father, he has a lot of metallic implants in his body, so in sometimes, like even in the angel suit, the combing CT has a lot of metallic artifacts, but with this newest model, the metallic artifact reduction is quite good. So I can still see the contrast median spreading through the foramen. Okay, so this is the post-procedure. You can see the contrast median spreading along the nerve root. Okay, so this is the contrast median spreading along the nerve root. So it's a very pity because the video is around five minutes, but I cannot show it. So maybe I can try to show another video from GE Healthcare on the YouTube. And this is an American doctor. He also performed a lot of PAE in his clinic. So he also used OEC 3D for PAE embolization. So let me try if I can play this video. If you have any question, you can ask me now because it may take five minutes.
Okay, Dr. Lu, do you have other contents other than the video? 你其他还有其他的投影片要讲吗？差不多。Okay, let's try try a little bit more to see if that works. But okay.
At GE Healthcare,
Okay, sorry for the delay. So this is a good example for how we do the treatment with precise image guidance.
My name is Yosef Galawa. I'm an interventional radiologist based here in New York City. I came to this setting about 3 years ago, and my goal was really to provide high quality and high-end outpatient.
So it may take some time for the staff to play the video. So I'm really sorry. So maybe we can have some brief discussion now.
Can I have Dr. Jiang, please?
Thank you for your excellent talk. Would you recommend we use OEC CT in our routine operating room for like a biliary procedure or GU tract procedure, or even tumor ablation therapy like lung ablation therapy and liver tumor ablation therapy?
Thank you, Dr. Zhang. She mentioned a very important topic. Because it took around 10 to 20 seconds to do a combined CT, if we didn't put a patient to sleep with intubations, the breathing pattern will affect the community's quality very large. So I tried once to see the liver and the kidney because the patient said he has kidney stone and some gallstone. So let's try a combined CT, but because he cannot hold his breath over than 20 seconds, so the quality is quite bad. But however, in head and neck region is quite good. And I heard from GE that some of the hospital doing bronchoscopy with imputation and under the combined CT guidance. This is very useful because when you use 2D fluoroscopy, you cannot see which branch the bronchoscope goes to. So with combined CT, it helps a lot for the, okay, so let's play the video.
My name is Yosef Galawa. I'm an interventional radiologist based here in New York City. I came to this setting about 3 years ago, and my goal was really to provide high quality and high-end outpatient interventional radiology procedures, and that sort of ranges from a lot of embolization procedures that we can offer to patients in the outpatient setting, as well as treating venous disease, as well as peripheral arterial disease.
So this is the routine practice. Me and Dr. Luca practicing PAE. The vessel is really clear.
The strong points of the OEC machine for this, again, it has the 3D capability, which I feel is very important. An option even for experienced operators. I think it's important to have this capability. The machine doesn't overheat, which is another problem you can have with other machines. So the cooling is certainly adequate. Even with larger patients, we really haven't had a problem. And some of the features also I thought were really important. For example, you can magnify without increasing the radiation dose. Again, when you're doing very delicate movements and trying to catheterize very small vessels, you really want to be able to see
even
very
a tiny
well
splash
your
I can
movements.
see
They have
is
a
on the
beautiful,
OEC
large,
3D
high
monitor.
resolution screen also.
So under the
which
combined
I
CT
thought was
guidance, we
really
know
great as
all the
compared to
perfusion is in
some
the
of the other
prostate.
competing,
So we cannot,
units.
we can
It was
assure
really
the
easy
patient
work. Our
there's
staff
no
and
any
myself,
non-targeting
picked
embolizations.
it up pretty easily, and the machine's very intuitive. Specifically, we're doing prostate artery embolization procedures with this machine, uterine fibroid embolization procedures, genicular artery embolization procedures. We're doing venous embolization procedures, as well as doing other arterial revascularizations and peripheral arterial disease treatments. We've had really great experience with this machine. So we're able to differentiate, 2-3 millimeter vessels. We're able to see vessels that overlap, which sometimes can be difficult to discern where the origin of certain vessels are if the resolution is not adequate. We're really able to see that very well. And I think, again, in a high volume center like ours, who are really doing a lot of these procedures, we felt that this machine has performed exceptionally well. Utilizing the OEC technology or utilizing this machine, we're able to create mapping to guide our catheters. And then once we're in the blood vessel, we're able to do 3D imaging or using the cone beam technology to actually confirm that we are in the correct location. So we're able to, again, be able to deliver the embolic with more confidence using this technology. With certain embolization procedures, the ability to do 3D allows you to treat more accurately with greater confidence. So the system also is really great for doing vascular work and for embolization work, in the sense that there's really good resolution and clarity of even small vessels, and you're able to catheterize and you're able to create roadmaps like you would with almost any fixed unit. I don't find that this slows me down at all versus a fixed unit in my experience.
Okay, thank you. So go back to the chessman, and as I know, in some small hospital, they don't have the hybrid OR. They also use this combined CT for navigations, because if they want to like to do a small subsegmentomy for the small lung nodule, they can also use the robotic machine to use navigation with this combined CT. So sometimes they fuse the CT image into the robot, but sometimes they use combined CT. It's also good. But the benefit is good, but sometimes the dose may be too high, but there's not big data for us to see on the paper. Okay, so in conclusion, I plan to do a pain clinic at first, but I see more potential on this machine, so I invited Dr. Luta to my clinic to practice some men's health. So nowadays, we are doing not only pain management, but also ED with BPH or even prostatitis, because as we know, prostatitis may also cause pain. So thank you so much.